So we're sitting here on May 6th in the home of Dr. Joe Murray, and we're going to interview Dr. Murray by Dr. Barry Noon, the current Executive Director of the American Board of Plastic Surgery. Dr. Noon and Dr. Murray, thank you for being with us.
Thank you, Jim.
Yeah, let's do it. Okay. People always...
Can we take a look at this?
Yeah, wait, look at this first.
Okay.
This is what they give you when you get you go to the...
When you go to Stockholm?
Yeah.
Okay.
And here it is.
I'll just open that for you. And this is in Latin, obviously.
It's in Swedish.
Swedish. Okay, this is in Swedish.
Yeah.
I don't read Swedish.
Anyway, there it
the
is.
The one thing I recognize on this is Nobel Prize.
Yeah.
And Joseph E. Murray.
Uh-huh.
And I can see other things on here. It has organ transplantation.
Yeah.
I can read that in Swedish. And they give you this when you go there, and this says this was presented in Stockholm in December 1990.
That's right.
December 1990. And then they have a medal also, is that right?
Medal. And this is on both sides. And it's interesting. You can take it out.
And this medal, they hang around your neck when you do that, or just presented to you?
They hand you that.
Hand you that.
And then, when you finally go through the whole week there, you go to the Nobel Foundation, sign in the book, and get registered. And when I went over with my wife and one of my kids to get it, they said, we also, the medal is solid gold. We keep it in the box, the security bank down below, but they give you this. It's about 99% solid gold.
Okay.
And then, you'll get a kick out of this, they said, and we give you 2 extra medals for your family. So Tom, our 5th child, happened to be with me. He said, well, we've got 6 kids. And so they laughed and they said, okay, we'll give you 6.
Wow.
So we've given one to each child, and we've had it framed, and each one of them, Karen's got one with her at her home, so when we visit our kids, we see the thing, and it's kind of nice. We all can thank Tom for that.
Oh, that's terrific.
Yeah.
You know, the specialty, as you know, has been very proud of its only Nobel laureate in plastic surgery, and this is really has shown a great light on the specialty of plastic surgery, obviously, and because not that many American surgeons have been awarded the Nobel Prize, and it's just terrific that has happened. The examination of the board examinations, we were talking about that for a while. Do you recall when you were director of the board what you did most of the time you were setting standards for training?
Yeah, we did. We were very concerned about plastic surgery's image. We formed the Research Council, as you know.
Right.
Milt Edgerton and Robin Anderson were very part of that. But we were anxious to get respect from the rest of the profession. And a lot of there was no place in Boston, for example, you could train. There was plastic surgeons were just considered sort of a feat of
Sure.
no respect at all.
Yeah, and you certainly stimulated a lot of respect for plastic surgeons.
Well, Brad Cannon really was my mentor
Mhm.
here in Boston.
Sure.
I had never met him until I got to Valley Forge, and but we used to talk when we were scrubbing. Then we'd go back to Boston and try to build up some respect for the specialty. And I worked for him for 10 years in his office. Plastic surgery was sort of something people dabbled in,
Yes.
and akin to cosmeticians, I think.
I understand that. And that was a time when we needed to get respect. And
Yeah.
certainly the wars helped us get respect,
Yeah.
both World War I and World War
Oh,
II,
absolutely.
and then Korea. And that helped the respect of the specialty, but we're still fighting that problem.
You always will.
Well,
You always will, because it's lucrative.
yeah, it's
Yes.
so there always will be the melding of the cosmetic surgery with the reconstructive surgery
Absolutely.
to some degree.
Yeah.
Do you see a solution for that?
Sure. Just pick people that have got the proper motivation. People ask me what the young people, or yesterday, this bunch of people, they always ask, what is your advice for the future? Say, follow your heart. Follow your something that you really enjoy, because you always have ups and down periods in your life, and if you're doing something for your heart, you'll just get there.
Yeah. Well, what we're seeing now is that we're seeing the best and the brightest coming out of medical school that want to go into plastic surgery.
Yeah.
The quality of the applicant to the specialty has really increased.
Isn't really.
Yes, so we're really pleased with that, and it's so I think there's a bright future.
Oh, of course.
And
The
it's,
future's always bright. Every day is a new beginning. Listen, my soul, to the glad refrain.
that's terrific. What we're going to do with this is hopefully show this video at the 75th anniversary
Okay.
of the board,
Yeah.
and show it, at least show it to the board of directors, and it's something that we are really going to. We're being filmed here by Dr. James Wells, who's the historian of the board, and Jim has come up with a number of questions, and I think we've asked many of them. And what do you think, Jim, about other phases that we should do here?
Dr. Murray, what kind of particular amusing recollections can you remember about your time on the board?
On the board,
Yes, sir.
Some funny answers that people may have given when you've asked them a question?
you know, I almost have a blank on that.
Really?
The board, I was very proud to be, I think I was a chairman, I don't know. But
Yes, you were the chairman.
I was. And then I was in the studies section of general surgery. Then I was in the study section of immunology with that guy out in the West Coast. Anyway, so I don't remember much about. It's probably. What do I remember about the board?
Well, with everything you've done, you know, that was probably a very small part of your academic
Yeah,
activity.
it was really. I spent a lot of my interest in the American College of Surgeons.
I know.
And then at the medical school, I ran the research lab. Now, the research lab was wonderful. It was formed by Harvey Cushing, who came up as the first surgical chief at the Brigham. And he, Cushing, insisted that the research lab be in the medical school, not the hospital. And it's still over there. It's got, as a historian, you'd be interested if when you come up to Boston, go there. We've got a whole exhibit of the founding of that surgical research lab, and with a history of what's cardiac surgery, plastic surgery. It's and the student educational center.
Uh-huh.
I worked with the deans, all 5 deans of medical school,
Uh-huh.
in melding the medical education into the general curriculum of the school.
Excellent. Now, on Monday, we're going over to the school on Monday. We're going to to the Contway Library
Yep.
and look at the archives and
Okay.
see what we have in the archives of plastic surgery, which the board has donated all of our historical information
Yeah.
to the Contway Library
Yeah.
in the archives, and I know that you've been there and you've
Well,
seen
Bob
that.
Goldwyn is the one that
I know
thought
Bob.
about that.
He
You know
certainly
how
did.
he got the idea? Bob was a real scholar.
Oh, he was.
And I miss him terribly. But he said, you know, he got a letter from the widow of Villeray Blair, I think. And she didn't know what to do with them. And they were going to throw them all out. So Bob said, we're going to establish something to have a repository. So it was his idea, with my backing, to get that thing done. And then, at times, there were a lot of people in their cities. I remember Cliff Keen wanted to have it in Cleveland, and somebody else wanted it somewhere else. But Bob and I felt that we wanted to anchor it at the medical school. And there was a great push somewhere along the line to move it.
I know a lot about that because we've been through this in the last few years. Actually,
Have you?
over the last 10 years.
No kidding.
Yeah, they've been wanting. People have said, well, maybe we should move this to the ASPRS office in Arlington, outside of Chicago.
Yeah.
Maybe it should be moved to different places, and we were stuck on what to do because the board has more information and more of our collection at the archives than anybody else does. We've got a large volume of material there.
Yeah.
So we finally came to an agreement that we were going to donate it to the archives, to the Contway Library.
Good.
And because the archival information is the most important thing.
Yeah.
You need an archivist. You just can't have them in a box somewhere.
That's right.
You need an archivist to do it. So we all got together and finally had the specialty come together to say, okay, we're going to leave it all at Contway. Harvard owns it now.
Yeah, good.
Harvard owns it, and we are allowed to use it anytime we want. So we can look at the board information.
Wonderful.
But a lot of the so we can do that. In the past, it was we couldn't look at it for 75 years.
Yeah.
Or 50 years, or whatever the information had
I
about
didn't
this,
know
which
that.
was not really
ridiculous.
accurate enough, and it's ridiculous. So now Harvard runs it. We go donate it to them. We don't have to worry about paying for it
Yeah.
because the archivist is a Harvard employee,
Yeah.
and it works just fine.
Oh, good.
Yeah.
That's great.
So
Well,
you'll be happy to know that.
Yeah. I remember talking to Dr. Kazanian about this, and and I got to give you a story that when I was a young whippersnapper and came back to Boston, I had had a lot of head and neck experience down at the Sloan Kettering.
Oh, sure.
And I'd had all the Ballet Fours, thing. So the Boston Surgical put on a session on surgical treatment of cancer. And I was delighted to be asked to talk about head and neck cancer. And all the big wheels were there. And I can remember giving the talk. And Brad Cannon and Dr. Kazanian sat on a table so I could see them. And seeing them there was wonderful because it's made me feel I had friends. But I talked about all of the radical stuff and bone
Sure.
grafts and everything. Because even the big wigs in Boston didn't know how to reconstruct anything. They all felt they could, but they would just leave it.
Sure.
So it was wonderful, and so it was a great success. People still talk about it. Then I'm getting up to Dr. Kazanjian left all of his World War I stuff to the Conway. He's got the casts up there still.
Yeah.
We get a lot of our casts from Valley Forge up there.
We've got a number of casts in the board office in Philadelphia from World War II.
Do you?
Yeah, Kurt Lamp, who was in Philadelphia,
Yeah.
was stationed in California, and he has he gave me
Good.
his casts
Good.
that he had carried around since World War II, and so I have them in the board office, which is nice.
Well,
That's
I'm
very good.
delighted that that the group is not anxious, not willing to remove them from the
Oh
company.
no, we need the Countway. The Countway is where we want to go on Monday, and we're going to look at what we can.
When are you going there?
9 o'clock Monday
9
morning.
o'clock?
Yeah, we've talked with Catherine Hammond Baker, and she's the woman that we were in contact with
Okay.
there, and she's going to have us look at some of the information.
I don't mean to intervene, but if it's okay, I'd like to join you.
Sure.
We'd love to.
I'll get my assistant to drive me in, because I have an assistant for four days a week.
Nancy Ehrlichman.
Hmm?
Nancy.
Yeah.
Yeah. That would be fabulous. Nancy is terrific, and
Oh, she's terrific.
if you're with us, we'll have a lot of influence because then maybe they'll let us photograph some of the stuff.
Well, let's tentatively plan on it.
Sure.
Okay.
Well,
I would like to do that. Might even get you over to our surgical research lab, show you some of that stuff too.
That'd be
if you
great.
got the time.
yeah.
That'd be great.
Go through some names that Dr. Murray may have interfaced with through the years, and see if there's any short stories that he can remember. You
Sure.
mentioned Dr. Cannon who you considered your mentor.
Yeah.
Any stories about Dr. Cannon you would share with us at this time?
Oh, sure. He's a very blunt guy, very honest. One of my colleagues, John Mullican, was the St. General Surgical resident at the General. And one day, when he said, Dr. Cannon, Dr. Cannon was operating, do you need any help? I said, no. But if you want to learn anything, you'll scrub in. He just, I remember once in Valley Forge, I was operating, and somebody came in and said, Colonel Cannon, the CO wants you to come to a board meeting. Cannon, with other words, tell him to go to hell.
Did you know Bill Ray Blair?
Who?
Did you know Dr. Blair?
No,
You did not know him.
no, but I knew his son. His son came through. No, I didn't know Bob.
I knew Dr. Ivy. Did you know Dr. Ivy?
Bob, yeah. Bob, and Jerry Webster.
Sure.
How about some stories about them? What can you remember about Dr. Ivy and Dr. Webster?
Well, I can remember them being at meetings, playing croquet, and a gentleman, I remember one of my kids came very friendly with both Jerry Webster and Bob Ivy. Ivy came up from Philadelphia quite frequently.
Oh, sure. He traveled a lot.
He did?
Yeah.
Yeah.
I knew Dr. Ivy when I was a resident and a young attending, and he was then getting very senior.
Oh,
But he would come to conferences and participate.
yeah.
Very nice man. Did you know John Stage Davis? Did you know John Stage Davis?
No, I didn't, but I know his son Bo.
Sure.
Yeah.
He
Bo
was.
was at Valley Forge.
Yes, he was.
Yeah. No, I didn't.
Who were some of the other doctors at Valley Forge? I know Milt Edgerton was at Valley Forge.
Yeah.
Did you get to know him there?
Yeah.
Edgerton?
He came in after me, and actually he was assigned to my ward to help me. The action was in plastic surgery, obviously. Then the front wards were plastic surgeons, but as it expanded, they needed other wards. By that time, I found this out 5 years later that they had noticed that Brown had seen me around the wards at nights and weekends talking to the patients, but I enjoyed it so much. And Brown, told me 10 years later when I gave a talk at St. Louis, he said, "Joe, did you ever wonder why you stayed so long in Valley Forge?" And others would come in overnight and then you sent overseas. I said, "Yeah, Barrett." I said, "I did." He said, "Well, I saw you visiting the wards and talking to the patients weekends and nights and everything." And he said, "I asked the CO to keep young Lieutenant Murray." I didn't know that for about 10 years.
So
later.
then you were a lieutenant instead of a PFC. You got
Yeah.
you got promoted.
Yeah, I know. Then there was a downside to that, though. Then when the war came over, all the old guys got out, and we were left. It was Andy Moore and myself, the only two.
Okay.
So we were frozen into position, but we got an extra promotion. So I ended up as a major, but I couldn't get out. And Elliot Cutler, who was the chief at the Brigham, was a big wheel. He was a brigadier general, and he was dying of cancer. And I got a letter from him saying, "You had a good record, and we'll take you here at the Brigham to finish your residency, no matter when it is."
Oh, that's terrific.
It was wonderful.
Yeah.
It was wonderful.
When did you start a residency at the Brigham? When did that happen to you? How did that come about?
Well, I got my first appointment at the Brigham for 9 months, and then I was immediately
Yeah.
sent to New Jersey for assignment for overseas.
But when you started training people,
I started training.
when the residents would come to you to learn how to be a plastic surgeon,
Yeah.
did you have an independent residency at Brigham, or?
I made it.
You
I
made
was
it.
the first one.
Yeah.
Yep, I was the first one because I sent Bob Goldwyn to Pittsburgh. I sent somebody else, one other, Bob Goldwyn to Pittsburgh.
And then you brought these guys back, and then they helped you with the training program. They helped you teach people.
Yeah, Bob came back. The first surgical resident in Boston was John Woods, went out to the Mayo. He came from the Mayo Clinic. He spent 2 years with me. Then he took a year on the lab, and then he went back to the Mayo as head of plastic surgery and head of their transplant unit.
Yes, and then he was chair of the American Board of Plastic Surgery.
Was
John
he?
Woods was. John Woods was chair of the board in my first year on the board.
No kidding.
Yes, he was quite prominent. He did very well in academic surgery after you
You
trained
know
him.
about his boyhood?
Don't know his boyhood.
He was born in China, and he spoke Mandarin very well. He used to ride his bicycle as a kid on the Great Wall. And as a matter of fact, I was talking to him just last week
How about that?
because he was written, they were very close. His daughter was a well-known Metropolitan Opera singer. John is a very dedicated human being.
Yes, he certainly is.
He's one of the outstanding persons. You know, I can't get over the good fortune we all have spending our lifetime knowing what we would like to do. And so many people seem lost and life has no meaning. But gee, every day is such a blessing. Every minute. You don't know what tomorrow's going to be.
That's right. You don't, but you're absolutely right. We have been blessed to
Yeah,
work in a wonderful profession of medicine,
yeah.
and then a wonderful specialty of plastic
Absolutely.
surgery, which is always changing and
Always.
always developing new,
Innovative, new ideas.
creative.
Yeah, it's wonderful.
Well,
So if you're going to talk to a young man asking about plastic surgery today, a young man or woman, what message would you give them?
I just say work hard and enjoy it. Just follow what you want to do. I'm not one to speak because as a little kid, for some reason, I knew I was going to be a surgeon. No family background in medicine, but I'm just going to be a surgeon. People would put their hand in my head and say, well, what are you going to be? I'm going to be a surgeon. I think I was influenced by books I'd read, Paul de Croof, I was the one that got Bob Go to work with Albert Schweitzer. The word got through that Dr. Schweitzer wanted somebody that could help him with his surgery, and they asked me about it, and I thought Bob would be a great one, and Bob did. And have you read Bob's reaction to working with Schweitzer?
I read parts of it in some of Bob's other writings, but I didn't read the entire.
Yeah, well, he said that he got very close. Bob spoke fluent French, so they spoke of nights and everything else together. And there were a lot of visitors come to visit, and they'd get a picture taken, and then they'd leave. But Bob was there for, I think, 3 months, and he just, but we even got to know Dr. Schweitzer's daughter, who just died, or maybe granddaughter, but when she come to Boston, we'd get to know about them. I mean,
I think that